Hello. Now we're going over Chapter 13, Vitamin Mineral Replacement. We're going to just briefly go over how vitamins play a part in our lives and how they are either go through organic substances. Populations can actually find them more readily available in non-processed foods. There's fat-soluble vitamins and then the water-soluble vitamins. Now, vitamins are organic substances that are necessary for the normal metabolic functions in our body, for growth of tissue and healing. The body needs only a small amount of vitamins daily, but need to make sure they have enough. So the FDA has come up with the amount of vitamins that we should have in a daily use. And you will see when you're looking at your vitamin label that there will actually be a percentage that vitamin has per regulations of the FDA. So therefore, that's one thing you need to look at. There's a lot of hype out there. Just know that there are some vitamins that you need to make sure that you eating a good source of non-processed foods, and what vitamins are in a actual choose my plate theory, because that's the healthiest way to obtain the vitamins. With the deficiency of certain vitamins like vitamin A, you'll see night blindness, skin lesions, dysfunction, mucosal membranes. Say, for instance, if you're eating certain foods that will deplete, or drinking alcohol, or they may void some minerals and vitamins in your system. So you will have to, the people, you will have to teach them that they will have to supplement if they don't totally get off of what they're doing. So tetracycline, you want to know that if you're taking tetracycline, vitamin A will affect it. Also, zinc is a big part of, will help inhibit tetracycline absorption. So with vitamin D, we get it rapidly through the sunshine, food, but as we get older, we don't readily absorb, and especially the increased melanin count of the skin with either darker colored ethnicities will have the melanin will actually inhibit the absorption rate of the vitamin D to our body. So the deficiency with vitamin D, with rickets, and then you'll see the osteomalacia in adults, which will affect the bone, the softening of the bone. The absorption of your calcium will be reduced because of the fact that your calcium, remember, needs vitamin D to be absorbed readily. So if you have too much vitamin D, it can build up toxicity. But also, most vitamin Ds are fat soluble. So when you take it, you should take it with your food. It can cause nausea, it can cause hyperkalemia, and other problems. Now, vitamin E is also fat soluble, so it will build up with toxicity in your blood. You want to count start low when you're starting to take vitamin E, because vitamin E has been proven to help with the circulation in the blood. It actually does thin the blood, so it comes in units. You want to start out with 200, and build up to the 800 units because of the fact it can cause toxicity and it should be taken with food. Um, when you have a deficiency, you'll see a breakdown in the red blood cells, and also you'll see um, dryness in the skin, fatigue, weakness, mental clarity will be reduced, headaches, breast tenderness because it's associated with hormone transport, and actually um, taking too much will increase your bleeding because, like I said, it thins the blood. Now with vitamin K, you can get those with the green leafy vegetables. You want to take that, and it's really encouraged, but with people that actually have taken Coumadin, they're discouraged to take the vitamin K because of the clotting issues that they can cause. Now, of course, deficiency, opposite effect, subcutaneous hemorrhage. You're having issues with the clotting factor because when you have a newborn, they do not produce vitamin K, so they have to have a vitamin K supplement. But because of the fact with older adults, people with issues with clotting factors and having blood clots, they want to eat less vitamin K foods. And so it's good to know where your vitamin K foods are, and those are those green leafy vegetables. Now here with B complex. B complex is a really important related to our nervous system. We are It's water soluble, so we readily sweat and expire. So we can avoid our vitamin B vitamins out readily especially if we urinate frequently. So look at these and know that it's very important, especially with people that have different genetic deficiencies or alcohol dependencies. They need more B complex. And you cannot overdose in B complex because if you do, you pee it out. Now with vitamin C is something that really promotes healing. They have found it's great with skin. Lack of vitamin C, you'll see slower healing. You can't overdose on vitamin C. If you do overdose on vitamin C, what it will cause is diarrhea. So you're eating plenty of oranges. If you eat too many, or any kind of vitamin C like foods, too much, you'll know by increased stools. Now, with folic acid is something that several people, you can see in genetic traits that don't absorb their folic acid properly, and you correlate with this form of vitamin B. And so, and especially with pregnant women, a deficiency in folic acid can cause birth defects, spina bifida, different issues. So you make sure that you have to take at least 1,000 milligrams, or actually 1,000 micrograms, which means 1 milligram a day of folic acid to get your required amount. Now, you can see that if you do not get the proper absorption rate, it also can cause issues with your clotting factors. There's antiphospholytic syndrome. that is something that some people don't absorb their folate properly, that will have increased chances of blood clots. So now with vitamin B12, there's that genetic factor that you would like to look up and see that people genetically do not absorb, that can also lead to certain types of anemia, certain type of like Parkinson's, nerve disorders, ADHD, depression. So you want to, they have starting to look and see with the way people eat now, they eat on the go. They're not getting the vitamins they normally get, and they're getting more issues. And they're taking medicine, which is a Band-Aid, to help this issue, but the underlying factor can be as simple as eating proper nutrition. Now, with this being said, you're looking at nursing diagnosis and the nursing process of vitamins. You're wanting to look and assess what's going on with the patient, especially with this day and time. There's so many blood tests that can be run to see if it's a genetic factor. If it is, you want to educate the patient. You want to select a nursing diagnosis and the plan that will be implemented to help with the goals that you want to obtain. So you want to look at your minerals. Now with your iron, you want to know how you take your iron, because your iron, you'll see people taking it with their food. You can't take it with your food. You got to take it between the meals with orange juice. It needs to have an acidic base to be able to be absorbed. These are all minerals that our body needs. Some people have an abundance of iron. Some people have a deficiency in iron. So we want to make sure we balance these minerals out. Now, just like I said, there's deficiency and iron toxicity. This, like I said, genetically, hemochromatosis is a toxicity, which people will actually have a ratio in their blood that actually affects the fibrin and the fibrinogen that is clotting factors, and also as a heavy metal. And that heavy metal will deposit into the organs. So you have to look and see. It's so important when you have people with cardiovascular disease or liver disease. Don't always pinpoint it's secondary to just a lack of exercise, or just make sure with this day and time, we're in a higher plane. Don't stop, and do encourage less Band-Aids and more testing. Now here we go with copper. And your deficiencies would be anemia, decreased white blood counts, decreased skin pigmentation or hair pigmentation. You see also with B15 or PABA, which we'll see in the B complex family, you'll see a lack of melatonin and the hair pigmentation. But then also with copper, it can be associated with glucose intolerance, mental retardation. You can look up Wilson's disease and how it's correlated with that. Zinc. Zinc is really important. It's also been looked into recently in how people that take at least 50 milligrams a day have had less cases of issues with coronavirus or the COVID, because it actually helps encapsulate the cell wall. You can find it in shellfish, oysters, sea fish. It's really great. It helps with men with issues with prostate problems. You want to make sure you wait at least 2 hours after any antibiotic. Like I'd said earlier, it will interfere with the antibiotic absorption. So it will cause issues if you take too much. But also know that it is a balanced diet of your vitamins and minerals is positive. Now, chromium, this is a big hype lately with the chromium. You see a lot of it in the diet supplements. You have in the meat, whole grains, brewer's yeast. Brewer's yeast is also associated with helping with the thyroid gland. And so the chromium helps speed up metabolism. Just with the, theories in the education states. Now, excess doses, though, will cause hypoglycemia if concurrent with a hypoglycemic or insulin. Here we have selenium. You want to know your function, food sources, and if you have excess doses and what it can cause. It acts as a cofactor for antitoxin and actually protects protein and nucleic acids. And it helps with you see a lot of doctors prescribing it to elderly because of the fact that it is an antioxidant. Just go over your nursing process with minerals, your planning, and use your practice questions with the back of your book, your Elsevier. Just know your materials. If you have any questions, just let me know.